Winters are lovely for some people, especially from warmer areas, but in the UK, winters are sad and dark, and it also brings a lot of new problems related to throat and lungs. Welcome back to What Is section of my channel. Today we are exploring tonsillitis. For the newcomers, I am Dr. Hashmi working in the NHS UK. Tonsillitis is defined as the inflammation of the tonsils. It is usually caused by the bugs, commonly viruses, but occasionally bacteria can get too comfortable as well. Tonsils are small glands in our mouth and they are part of our defense system. There are two of them and you can find them easily at the back of your throat, or they will find you if they are getting too big. So tonsillitis can commonly present with sore throat, fever, headache, nausea and tiredness. And these are some common viral type of symptoms. People can also get pain while eating and have some swollen neck glands. Sometimes you might see white spots on the tonsils, that would be pus. Symptoms normally develop for 2 to 3 days and then start resolving. Should you be worried about it? Frankly speaking, no. You don't have to worry too much about it, but if symptoms do not start to resolve in 3 to 4 days, or if they are getting worse, then be aware of some red flag symptoms, for example, difficulties in breathing, swallowing and opening mouth. Particularly if fever is persistent and your symptoms are mainly on one side of the throat, because that would indicate a complication called quinsy, which is collection of pus around tonsils, and it would need antibiotics and may also need a small operation to drain the pus. If you develop any of these symptoms, you should seek urgent medical help. It doesn't normally need any treatment because people get mild symptoms. However, it is really important to drink plenty of water. Paracetamol or ibuprofen will help to ease pain, headache and high temperature. Sometimes gargles and sprays can make a lot of difference, but they do not shorten the duration of illness. Symptoms will start getting better in 3 to 4 days and they will be gone by the end of the week. If you get repeated episodes of tonsillitis, you should ask your doctor to consider tonsillectomy, which is a surgical procedure to remove tonsils. It normally depends how frequently you get the episodes and the number of episodes per year. For example, if you had 7 or more episodes of tonsillitis in the preceding year, or 5 or more in each of the last 2 years, or 3 or more in each of the last 3 years, then you can ask the doctors to consider tonsillectomy and I'm sure they would be able to facilitate it. The most common questions that we as doctors we get asked if antibiotics are useful. The answer is usually not, because most of the throat and tonsils infections are caused by viruses and antibiotics are mainly given for bacterial infection, although sometimes bacteria can grow and cause infection as well. Without tests, it is really impossible to tell if it is viral or bacterial infection. Your doctor might prescribe antibiotics if the infection was severe or if your immune system is not working properly. For example, some patients who are on chemotherapy or had their spleen removed, they could get antibiotics from doctors. And there are some criterias, for example, fever, pain, and there's another one as well, but it is beyond the scope of this video. If symptoms are quite severe or affecting your ability to go to work or school, then you may consider taking some time off. In nearly all cases, this infection or sore throat clears away without leaving any problem. One thing that I want to highlight that this infection may spread by close physical contact with other people or by droplets in the air caused by sneezing or coughing, just like any other infections like flu or cold. I hope this video provided you enough information to understand this common illness. Subscribe for more. Cheers.